Welcome to the WaterTech of America Safety Training Series. This presentation will cover crisis management at WaterTech facilities, as well as when visiting customers. The goal of this presentation is to provide basic responses to fire, medical emergencies, or disaster situations that we might encounter during our workday. Evacuation procedures are going to vary by customer. Today's presentation serves only as a guideline. If you hear an evacuation alarm at a customer facility, you will proceed to evacuate. Most customers are going to rely on a visitor log to make sure that you're accounted for, so it's imperative that you sign in and sign out. Make sure to note the emergency exits and meeting locations when you check in. It is important that they are not sending in response teams to rescue you if you've left the facility, or that you are inside and no one's coming to help. If there's a problem, the emergency coordinator will be notified if any employee or visitor does not show up at the assembly area. If there was an emergency at the office, you would be talking to the vice president or the person next in command that is on site during the event. Here are a few rules to be aware of during an evacuation. If you're running equipment, shut it down. It could be a hazard if left running. Evacuate the building. Don't block any fire lanes. Don't wait for any friends. Don't be casual. That doesn't mean we want to race out of the building, but there is a sense of urgency. Don't panic. Do not smoke. Smoking is not allowed in any of our facilities. We're going to follow assigned evacuation routes. At our office there are 4 exits to the facility. There are 2 on the south side of the building, and 1 on the east and west sides of the building. Depending on where the emergency is, you would try to evacuate at the opposite end of the building. Do not move any vehicles, and don't return back to your workspace or your workstation until you're instructed to do so. If any media shows up, direct them to the emergency coordinator or to Joe Russell, the owner. Don't offer any comments or observations. To evacuate the building, take the nearest exit that avoids the hazard. Meet at the designated assembly area. At WaterTech, this area is the field to the south of the building near the Wisconsin Athletic Club. If you're at a customer site, one of the most important things you can do is to identify the evacuation routes and where you should go in the event of an emergency. This information is typically available where you check in. Make sure you always check in and out when visiting a customer site. We are going to break fire down into 2 classifications: small and large fires. We will describe what defines each, and the response that should be taken depending on the classification of the fire. For any fire, it's important to remain calm and always alert a secondary employee about the existence of the fire. The secondary employee should call 911 and notify all employees about the fire. If it can be done safely, the first employee should extinguish the fire with a fire extinguisher. If the fire is extinguished, get a second extinguisher and monitor for reignition. Advise the fire department that the fire has been extinguished, and take the proper evacuation action steps to prevent a reoccurrence. If the fire is not extinguished with the fire extinguisher, then the facility must be evacuated. A large fire is one that you don't think you can take care of with a fire extinguisher. Remain calm. Alert coworkers or customers if you are on site at a customer facility. Then follow all of the emergency evacuation procedures that we discussed. Going to the nearest exit and meeting at the designated assembly area to make sure you are accounted for. If there is a tornado, a quick response can mean the difference between life and death. If there's an announcement or we hear the siren from the local municipality indicating a tornado, we want to immediately shut down all processes and go to the designated shelter area. It will be your responsibility to find out where this is at a customer facility. At WaterTech, we have 2 areas. One would be either the men's or women's bathrooms, or in the vault. If you're at a customer site, they're going to be responsible for bringing the visitor log and weather radio to the designated area. Don't go to the windows or doors, due to curiosity. When the danger has passed, an announcement will be made that it is clear to return to your workstation. In case of a chemical release, here are the basic steps to follow. Identify the spilled substance and evaluate the hazard. Determine if it is incidental. If so, notify the supervisor and, if trained, block off the area. For partial evacuations, notify the emergency coordinator. Otherwise, shut down equipment, stop the release, contain and clean it up, manage waste, decontaminate equipment, and dispose of waste. If the spill is not incidental, notify the emergency response coordinator and assess the need for a response team. If the on-site team can handle it, block off the area and follow the flow chart. For large spills beyond the team's capacity, call 911 or Veolia. In case of a medical emergency, call 911, assess the need for evacuation, and wait for assistance. If there is a chemical release, there are 2 forms that need to be filled out so that there is a record about what happened. One is the chemical release worksheet. The other is the customer accident, injury, spill report. Those forms are available on the team site under Safety. They should be turned in within 48 hours of the incident. WaterTech employees are only trained to handle incidental spills through our specific trainings on corrosives, flammables, oxidizers, biocides. Before addressing a spill, ensure you are familiar with the material and can manage the quantity safely. Assess if the spill poses any health or safety risks, and if adequate resources are available to control it. Consider the potential danger to WaterTech, its customers, neighbors, or the environment. Remember, doing nothing is always a viable option, and in many cases it's the safest option. Don't be afraid to contact the emergency coordinator to determine what steps to take. After a spill, complete a chemical release worksheet and the customer accident, injury, spill report. If the spill exceeds trained capabilities, engage the customer's safety team or call an outside response team like Veolia. In the case of a medical emergency, remain calm. Determine if the area is safe to enter. If you're at a customer, call for a first aid certified responder. Don't move the victim unless the situation is life-threatening. If you are going to come in contact with the victim, make sure that you put on the appropriate PPE and try to avoid contact with any bodily fluids. Do what is known as an ABC check on the victim. Is their airway clear? Are they breathing? Does it look like they have circulation? If medical attention is required, call 911 right away and be prepared to answer the location of the emergency, your phone number, what happened, how many people are injured, what are their conditions, is there any medical assistance being given to any of the victims. Do not hang up until you are given instructions to do so. There are a few kinds of medical emergencies you might have to deal with. For bleeding, you cover the wound with a clean cloth and apply pressure. Elevate the wound. Treat for shock, and call the rescue squad, if needed. If it's a burn, we're not going to apply any ointment or spray. We'll apply a clean cloth. Treat for shock and call the rescue squad. For choking hazards. First, ask the victim if they're choking. If they cannot talk, then we want to do the following things. Stand behind the victim and wrap your arms around their waist. Make a fist and place thumb side against the victim's stomach just above the navel and well below the ribs. Grasp the fist with the other hand and press into stomach with quick upward thrusts. If the victim is large or pregnant, give chest thrusts. You may need to do this several times to dislodge what's stuck in the airway. Make sure someone calls the rescue squad. If the victim has chest pains that might travel through the shoulder. If they are having difficulty breathing. Or if the victim has a severe case of indigestion or heartburn, this may be a sign of them having a heart attack. We want to call 911 immediately. If the victim has suffered a shock, we want to keep them lying down. We want to try and maintain the victim's normal body temperature. In cold weather, cover them with a blanket. In hot weather, try to keep them comfortable. Talk to the victim and keep them alert. Call the rescue squad. It is always better to be proactive. If you suspect poisoning, we want to try and identify what they ingested that would have poisoned them. Just like any of our products, we want to read the label on the container for first aid procedures for poisoning. We want to refer to the safety data sheet if there's one present and nearby. Call 911, the Poison Center, or if it is a WaterTech product, we can call Chemtel. Chemtel has our safety data sheets on file and they can walk through what to do. Unless you are 100% sure, the best thing to do is not give any fluids, and do not induce vomiting. That would only be done if we were instructed by a medical professional. If the victim is unconscious, we want to make sure that their airway is open and that they have a clear breathing space. Immediately call 911. Do not give any fluids. Refer to the safety data sheet for additional information. If you know that the victim has stopped breathing, we're going to tilt the head back and call the rescue squad. We have not trained anyone in CPR, but if you are trained, you can administer CPR. Depending on the size of the person, whether an adult, child, or infant, there's going to be various breaths given at different intervals. Always wear required PPE and work safely around chemistries in the field. If you get something in your eye or on your skin, you want to let somebody know right away. Yell help to alert someone around you. You want to get assistance or proceed to the nearest eye wash station or a source of fresh water. Hold your eyes open and rinse with that water for at least 15 minutes or until medical assistance arrives. In the case of an ingestion, we're going to contact the paramedics. Identify the material swallowed by referring to the container and the safety data sheet. If the victim has passed out, we'll tip their head back. Follow the general medical emergency procedures and don't give fluids to induce vomiting unless you've been instructed by medical personnel. From an inhalation standpoint, we should survey the scene and make sure it is safe to enter. If you think poisonous gas is present, stay clear of the danger and call paramedics. None of us have the proper equipment for this situation. If it is not a poisonous environment, and you can reach the victim, remove and get them to fresh air. Check their airway, breathing, and circulation. Call the paramedics. Refer to the product label and safety data sheet for inhalation hazards and first aid. That brings us to the end of our training. Please return to training today to take the short quiz.